everyone and welcome to the Chrissy B Show, the only TV programme in the UK dedicated to your mental health and well-being. On today's show, we'll be welcoming on Maggie Lennon from the Bridges programme based in Glasgow. It works to take refugees who have fled to Scotland and first-generation immigrants who are searching for a better life and help them to achieve the qualifications they need in order to have fulfilling careers. Maggie has also brought along one of their biggest successes, Laeth Al-Sadi. He was a trauma doctor from Iraq, but thanks to the Bridges programme, is now working to become a qualified doctor in the NHS, helping lives every day. At the end of the show, I'll be giving you my tips on dealing with cultural differences in relationships. But first, before all that, we're going to be catching up with one of our past guests, Steed, to see how she's been getting on following her last appearance on the show. When she last came on, Georgia was suffering the fallout from years of self-harm, anxiety and depression. She's now taken on many personal projects, jobs and further education, which seemed like an impossibility before. So let's see how she's getting on. Welcome to the show, Georgia.
Thanks for having me back.
Lovely to have you back on.
Thank you.
So the last time you were on was in February and a lot's happened since then, but for the benefit of our new viewers or the ones that missed the show last time you were on, can you just give us a background of the kind of things that you've been through?
So when I was last on the show, I spoke about self-harming from a young age, and how I got through that and dealt with depression and school life and growing up, really. Okay. And
you have been getting help for the issues that you've been going through?
Yeah. From a community mental health team.
Okay, and how's that going?
Yeah, really well. They're really good.
Well, yeah. Okay then. So tell us what you've been up to since. Like when you were on the show, I know you were quite nervous about being on, but how was that for you? How did you feel about yourself doing that program, and how did it help you?
It was very, I don't even know what the word was. I felt really good afterwards, knowing that I had spoke openly about something that's important. Obviously it was really scary, but yeah, no, it was good. I loved it.
Brilliant. Okay, I'm glad it was a good experience for you. So tell us, what have you been up to since February and since you've been on the show?
So when I was on the show last, I was running my own little business, but since then I've put more effort into it.
Okay.
I've had more passion for it, even though I've always felt passionate about raising awareness for mental health. I've just sort of realised the importance of it more.
Yeah, okay.
So I've been really putting a lot of time into my brand.
Okay. Tell us about the brand.
So I make things like craft things like bracelets, dream catchers, key rings, or anything really, just to raise awareness.
And it's all to do with mental health,
yeah,
isn't it?
yeah.
Like encouraging people that are
like nice
things.
quotes or positive messages.
Okay. And how is the business going? Because you had your first customer, was it Australia?
Yeah. When that happened, I didn't really believe it at first. But it was really nice. I'm really happy with it. I get a lot of people messaging me just on the account, just because they want to just talk about how they're feeling or something they're going through, which I'm perfectly happy with.
Brilliant. And what about your studying as well, aren't you?
Yeah, so I'm in my final year of university now. Okay. Which I don't think anybody can believe that I've made it to the final year. I'm still pretty shocked. But
why'd you say that? Is it because of the things that you've been through and the struggles that you've had that you didn't think?
I think out of everyone, I was the person that wasn't going to go on to further education because I really struggled at school, like I mentioned before. But no, it's been like the best thing I've ever done, going to university.
What are you studying?
Art direction.
Okay, brilliant.
Yeah.
So obviously that gives you a focus as well, doesn't it, doing that?
Yeah. That's the thing. When it gets to like the holidays, I start to struggle a bit. But now obviously I've learned that I need to give myself a routine, make sure I'm doing things. Whereas in the past I didn't.
Okay, so now you're ready, for example, you're gonna stop studying for a while for Christmas holidays, so you've already got something lined up to occupy your mind and stuff. Well, I suppose you've got your business to concentrate on all year round.
Every day I do something that's to do with that, yeah.
Okay. Any advice that you'd give to our viewers, Georgia, who maybe are also trying to study but they're finding it a bit difficult to cope?
I was the least organised person ever, and now everything gets written down, even, you know, have breakfast, because otherwise everything gets all crazy and mixed up and it's too hard to... When it's all in your head, it seems like so much, but then when you write it down, you can literally just tick it off, and it's the most like...
I love ticking things off.
Yeah, it just makes you feel so good. So you think, right, I've done that, don't need to think about it anymore. So yeah, organisation.
It's the key, isn't it? Definitely.
And it's amazing.
Okay, so you've been on February, now again this November. Future plans? Because we want to be kept updated. Do you have more up your sleeve?
Yeah, well, I want to carry on with Made by Georgia May, my business. I am thinking about doing a master's in art therapy.
Oh, wow.
Because I would absolutely love that job.
Amazing.
So I don't know if I'm going to do it straight after I graduate, but
it's good that you've got it already in your mind. Got a future goal for yourself. Amazing. Georgia, it's lovely having you on again. I'm so glad you're doing so well.
Thank you.
And we're looking forward to hearing more from you.
Thank you.
Amazing. All right, everybody, so that's the lovely Georgia again, and we do look forward to welcoming her back again, okay? And now we say a warm welcome to iridologist Ronald Delari Simpson as he chats to us about which essential oils to use in order to improve your overall health. Welcome to the show, Ronald.
Yes.
Lovely to have you back.
To be here again.
So today's all about essential oils.
Yes.
Tell us everything we need to know.
Well, that would take all night.
All right, well, we've got a few minutes, so see what you can do in a few minutes.
Well, what happens is that you remember last time we spoke in one of our sessions, we spoke about the taste buds, right?
Yes, I remember.
Well, all of the things are interrelated and they're all important that they're cleaned up, right? So it's very appropriate we talk about the immune system and herbs now, because in about a month or two it's going to get colder and colder. And with what I'm going to show you, you won't get colds, right? No, I haven't had a cold for 25 years, or flu, right? You see, what happens in London, for example, I see people jogging, right? They're jogging in the central part of London, and that is one of the worst things they can do, because the smog comes in and goes to their nose, and they accelerate it, so their body's oxidising more and more. They should actually be jogging in the countryside or in the park, right? So what actually happens is that part of the arsenal is to understand what herbs do, right? For not just the immune system, but for the whole body, right? Now, aromatherapy has been around for thousands of years, but it's only now in the last 20 years that scientists are proving with the research that herbs and the oils from herbs play a huge part into the immune system and keeping your body healthy, keeping your cells alive, right? So tonight we're going to be talking about you know, the importance. We've picked 5 of the most important oils I've discovered, and so the first one we're going to talk about is cinnamon. Okay. Cinnamon oil. Now, cinnamon oil, as you can see, we're going to go through it quickly. Strongest antibacterial properties, effective against common dental bacteria, causes cavities, root canal, helps to kill airborne bacteria, right? Can help relieve depression, very powerful. Helps stimulate the immune system. Okay, so that's cinnamon oil, right?
When you say oil, now, do you actually buy it in the oil form, or you just use it as it is?
You can buy it in oil form, and it's very concentrated, all right? To give you an idea, if you take lavender, just to give you an idea about the potency of that. If you you need 287 kilos of lavender flowers to get 2 litres of lavender oil.
Oh, wow, okay.
So it's extremely potent, right? Yeah. But you can also use cinnamon in powder form, but it's got to be fresh. And it's best to buy the cinnamon stick and crush them yourself. Okay, cool. You see, but you can also use the oil, of course.
I usually put cinnamon sticks in my tea.
Yeah, very good, very, very good for you. And it's lovely flavour. Yeah. The next one we're talking about is clove oil. Okay. And basically, I bought one to show you. So the cloves, this is what the cloves look like that, you see? Like that. So you can see they're little stems. And that is an amazing oil. You see, so what it does, it's been well known for teething pains and toothaches.
Okay.
Recalcify teeth, which is really important, right? Prevent cavities. It contains the same active ingredient as cinnamon oil, eugenol, right? So clove oil and cinnamon are very related, right? And effective in treatment candida, yeast infections, intestinal parasites. A lot of people have got intestinal parasites because of the way they cook their food, or they might be undercooking their meat. They get that inside the body. And it's also effective in creating acne, warts, colds, coughs, and asthma.
Wow. Okay.
We make a special tea where we put the clove oil or the cloves inside the tea with ginger and garlic.
Okay.
You do that every 2 hours. If you've got a cold, you get 2 hours and it just cuts your cold, bang, dead in its tracks.
Brilliant.
Yeah.
Okay.
I'm Australian. We're very proud of the oil eucalyptus oil, right? So eucalyptus oil is unique. They grow to about nearly 100 feet tall, and this contains an amazing oil in the leaves, right? And that's where the bushfires are so relevant. When you get bushfires in Australia, there's so much oil in those leaves, the trees explode.
Oh, wow.
And they shoot the oil to the next tree, and it's just, but that's what causes the oil, is eucalyptus oil in the leaves. Amazing stuff, right?
Wow. So
the eucalyptus oil is incredibly versatile. Look at this. It treats lice, skin infections, insect repellent. It treats asthma and other respiratory problems, right? If you rub eucalyptus oil here on the bronchial tubes when you've got asthma, it slows the asthma down like that.
Oh, wow.
Yeah, so you just rub it where the bronchial tubes are. That's where the asthma takes place. You rub it on there, right? That's very important. It stimulates mental activity. So when you get older, you get slower. If you use this every day, just inhaling it every day, your brain's just inhaling it.
Wow.
And when you're inhaling something like that, it takes care of your smell, your behaviour, your memory, and your sharpness.
It's fascinating.
Yeah,
wow.
it's all there. You know? So then I just straight, because what it does, the reason why this is so important, when you get the oil, it affects the hypothalamus. And the hypothalamus is linked to the limbic brain, and the limbic brain is that's your behaviour, how you feel, like your mood and all that. It's amazing stuff, right? So this is very powerful stuff. But that is very important for, say, kids as well. You can put on kids' chest and like that. Asthma, hay fever, sinus. It stimulates mental activity, aids in treating stress. If you've got stress, you put a few drops of that and you rub it in your temple here and a bit here. And just breathe out. You see people calm down like that. Within minutes, bang, they calm down, you know.
Does it knock them out, does it?
No.
All right, okay, just checking.
And then it promotes if wounds, cuts and sores. So if you're in the garden and you cut yourself, you just rub that on and you just keep rubbing on every 2 hours. It just heals it. Amazing, right?
Amazing.
So the next one, we got two more. Frankincense. Now, if you're a Christian, you would know that this was one of the oils that was 3 wise men brought to Jerusalem to give as a gift. That's known as the king of oils.
Wow.
It is also the most expensive oil, but it's amazing stuff, right? So it gives relief from bronchitis, congestion, boosts the immune system, right? In fact, they make a system now with the frankincense as a base. It's made in a little pellet like that, and you just put that in like that. It's called guarded. Put it in, and within about 6-7 minutes, you feel it going into your chest, and it boosts your immune system. That's the base. Amazing. Frankincense. Right? Not cheap, but it's brilliant. Huh? If you've got a cold, what's the cost of money? So effective remedy against stress and anxiety. It's rich in antiseptic, anti-aging properties. You can also put it on your face just here, and that creates real wrinkles.
Oh, just for that reason alone, that's just sold it for me. Okay.
Yeah, that is known as the king of oils, right?
Okay.
Last but not least, again Australian, the Melaleuca, and it's also known as tea tree, right? Yeah. And that is a very, very popular oil in Australia, very popular. And it provides healthy immune system function. It protects against environmental seasonal threats. Like, for example, if you've got hay fever season coming and you make a tea with that, and about a month before the hay fever comes in, you just put a few drops of that about 2 or 3 times a day. That builds your strength. It builds your when the pollen comes in, it strengthens it, so you build the phagocytes to fight the pollen infecting your nose, right? And then that's also very true. It gives relief from coughs, colds, and congestion. Again, you can rub it. If you use frankincense or eucalyptus and that, and you rub it on the bronchial part of the tube there, it just gives you amazing relief. No need for cough medicine, nothing. Just like that. And it also aids in the fast healing of wounds. So, you know, I'm very active, and sometimes I might get cuts, you know, with a hoe and all that.
Yeah.
So the moment I do that, just rub that in and bang, done. Yeah.
Brilliant.
So we're very proud of our organic garden at home.
Yes.
And so we don't believe in buying dry herb. It's just like useless, absolute waste of money. Like if you look at that bay leaf like that, look at that. That is true organic, and this is anti-cancer. So you can make tea with that. So if we say cook chicken, we'll put that in the chicken while we're cooking. Yeah. And we'll let it stew for about maybe 30 minutes. And then we just take the leaves out, and it flavours the chicken, and it puts the selenium in the chicken, so that's very strong for the immune system.
Do you actually cut the chicken and put it inside the bucket?
Exactly. Put it in. Exactly right, you know. And then this one, rosemary, the scientists have discovered in the last 10 years that is absolutely good for memory. Right, like that. Yeah. So it's been known for a long time, but it's been like a bit of a folklore, but now it's been proven scientifically. There's an oil in there called it's a rosemary, and you can see how healthy that is, right? That is like full of organic minerals. So every time I cook, I will take 2 of those, and I'll strip it down like that, and I'll chop it up, and I will put in chicken, fish, and so on and so on. You can put in meat, you can put in lamb, but the key is to get it organic. Yeah. That's the key. Okay. Anyway, and then last but not least, here's the cloves. Yes. Yeah, make tea with that. Ronald, thank you so much. Pleasure. Fascinating as usual, and we'll see you again very soon. Now don't go away, guys, because after the break we'll be talking to Maggie Lennon and Dr. Laeth Al-Sadi from the Bridges programme to talk about how they are helping him to become an NHS doctor. Alongside this, Chris Brown will be telling us about equality and diversity in the workplace, and Dr. Rob Hicks will be answering your medical questions. Welcome back to the Chrissy B Show, everyone. So we hope you've enjoyed our catch up with Georgia Steed, who gave us a great insight into what her life has been like following her previous appearance on the show. But now we have on 2 very special guests from Glasgow, here to talk about the Bridges programme and the work it does, helping those from other countries gain qualifications and jobs, and even helping refugees that are qualified in their own countries to become doctors here in the UK. We welcome on Maggie Lennon and Laeth Al-Sadi. Hello, welcome to the show, both of you. Lovely to have you on. So we'll start off with you, Maggie. Can you tell us a bit more about the Bridges programme, first of all? Yes, I set the programme up about 15 years ago, just as asylum seekers were being sent to Glasgow, and with the idea that we needed to reconnect people with their skills. The asylum process in those days used to take a very long time, so people could sometimes be years before they were able to get back into work. And it's developed over the years. I mean, I support people who've got leave to remain, and we support migrants, and we support anyone for whom English is a second language. And it's as much about giving people back their dignity as it is about giving people jobs. Anyone who's been unemployed knows how difficult that is. And it's also helping their skills and qualifications from overseas be understood by the labour market here in the UK, because obviously there are lots of differences. Because you've got all that talent there and those qualifications, all that talent skills is sitting, being wasted. And underemployment is as big a problem as unemployment for people from overseas. So, you know, the Polish teacher who's working in a pizza shop really needs to be working as a teacher rather than in a pizza shop, or a refugee doctor needs to be working as a doctor and not driving a taxi. Yeah. So can you just tell us maybe about some of the kind of mental health issues, maybe the implications that this has on a person sort of coming to a new country and then not being really valued and not being able to use those skills that they had in their own country. Chrissy, that's exactly why we set Bridges up, because we could see that was a real damage being done. And for people who've come through the forced migrant route, so that's people who've sought asylum and been granted leave to remain, they may have had some horrific things happen to them. So they may have suffered torture, the journey might have been very difficult, they may be separated from family, and that's a huge issue. And so a lot of our clients do present with quite serious mental health problems, and if they've been caught in the unemployment trap, then like anyone who's unemployed, that's difficult too. So getting their mental health back is part of what we do by engaging them in purposeful activity, developing their skills, finding them work placements, and then ultimately either getting them back into college, university, or a job. Okay, brilliant. It sounds amazing. It's fantastic. It's very rewarding work. Now we have someone here next to you with a big smile on their face. So tell us, how is the Bridges programme helping you?
It's just excellent. It has helped me in many ways ever since I joined the Bridges, became a client, and one of the things was getting me some placement with GPs to be in the field, working more or less as a doctor, to listen to patients, to hear patients, to try and discuss patients' condition with the specialist doctor over there.
Okay, so you're originally from Iraq?
I am.
So what were you doing when you were there? What was your main work?
I was a doctor there. I graduated 2002, and I worked for a while alongside the British Army. I was doing courses, training personnel in Iraqi army to become combat lifesavers, as well as traumatology and other fields of orthopedics. And we were doing courses with the British Army, and that's how I end up endangering myself.
Okay. So then you came here to the UK.
Yes,
what was it like when you first came here?
I first came here to study at first biomechanics, and it was very good for me, but I have not been able to go back. Okay,
all right. And now you want to go back into your normal field that you know about and
yes, of
you're
course.
confident in.
I am. In addition to that, I am planning on becoming a general practitioner.
Okay. That's brilliant. So how does it feel to be able to help
it's
people
fantastic.
in this
I've got the best job in the world, actually. I really, really do. And it puts your own problems into perspective. You go home at night and you think you've had a bad day, but actually, really, your day's not been as bad as some of the stories that I hear. And with the doctors, it's a job, but it's more than a job for doctors. It's a vocation. And when you hear them talking about how desperate they are to get back into that vocation, then it would inspire anyone. And that's why the program's been developed and why we've managed to get so many fantastic partners involved. So the GMC are obviously involved, the General Medical Council. They're the ones that tell us what the doctors need to do in order to requalify. The British Medical Association is involved. The Royal College of Physicians has just become involved. NHS Education for Scotland is involved. And the college is delivering the advanced English support. So we've managed in Scotland to get this fantastic partnership together for relatively small amounts of money, tiny amounts of money in the scheme of things, but we're having such great success. And everyone's committed because the women and men that we're working with are so committed, so it kind of inspires you to carry on. Yeah.
Can you tell us about maybe some of the other case studies, I suppose, that maybe have really impacted yourselves?
Well, we work with anyone, so we can work with cardiothoracic surgeons through to people who've never had a job or maybe left school when they were 12. And some of our early work was done, we did a lot of work with women who were trauma victims and who'd been victims of torture. We did a fantastic programme with the Open University, and we were getting women who'd left school at the age of 14 into university to study. Wow. We now have a whole access to higher education programme run with one of the big universities in Glasgow with tremendous results, and it's amazing to see people make that kind of leap, and people say, I never thought I'd ever go to university. We've had fantastic success with engineers because construction companies tell us that when students graduate from university in Britain and want to be engineers, they want to project manage. They don't actually want to put on a pair of Wellington boots and a hard hat and get on the high-vis jacket and actually go out onto the site, whereas most of our clients who were engineers, that's the kind of work they did. We're doing a lot of work in the social care area where we're getting women in, some of them at quite a basic level, but that they're getting trained on the job so that their jobs are sustainable. So it's pretty amazing, actually. About 75% of our clients either go into work or further education.
That's fantastic.
Which is a really tremendous result, really. It's better than if they just went to the job centre, they wouldn't get results like that. So we're really, really pleased.
Great. And what about future plans?
Well, future plans are always dependent on money, of course, and we're always chasing money. We're very lucky. We're funded by the Scottish Government, funded by Europe as well, which is a bit of a problem come Brexit. But we want to now develop and redevelop a programme for teachers. There used to be one. We want to extend the doctors' programme to include dentists and maybe pharmacologists, and then maybe other medical-related fields as well. We're thinking about doing a new programme for women returners. So some women who maybe did degrees a long time ago and have not worked because of family. So really, it's kind of anything that comes our way, we're willing to think about doing things differently. We're thinking about doing some different ways of doing skills recognition through running assessment centres and all sorts of things. So my staff dread when I go on holiday, because when I come back I walk in and I go, I've had this really good idea, and they think, oh no, not another one. But I mean, the doctors programme was the result of that, really. A colleague who worked with us at the time who suddenly became aware that for years we hadn't seen doctors in the city, and suddenly doctors were appearing. So there's 40 doctors on the programme at the moment.
That's amazing.
But there's probably a lot more out there that we haven't heard about yet.
I can just imagine how frustrating it must be for people that have all these qualifications, and they have not just the qualifications but the passion to do something with that and to help other people as well, and kind of feel like their hands are tied and they can't do anything, and then all of a sudden be able to have access to something like this. I mean, you must be so grateful and so happy to be on this programme.
Of course I am, because it has a lot of promises, and I never realised that something could happen this quick.
Yeah.
And I think the fact that Laeth wants to go into general practice, I'm really pleased about, because we have something like 500 GP vacancies in Scotland at the moment, and I'm really pleased. And I think about half of the doctors are thinking about general practice. And that's possible because they get placements with GPs, so they actually get to see what a GP surgery is like. And the support from the medical profession in giving placements and clinical attachments has been terrific. So I'm really pleased that he's thinking about general practice. I'm trying to get the doctors to think about not necessarily staying in Glasgow, and that going to other parts. One of our doctors has just gone up to the northeast of Scotland. I would love to get one of our doctors to go and work in Shetland and just see other parts of the country where there are lots of opportunities. So that's the next thing, is push them around the country a little bit if that's possible. And we had a lot of interest from health boards across Scotland. Okay, well, it's been absolutely amazing speaking to both of you. Please keep in touch and tell us how it's going, Laeth and Maggie. When Laeth gets his registration, we'll let you know.
Yes, you have to celebrate.
Very soon. I would expect within the next 4 or 5 months he'll get his registration.
That's amazing. I'm saying congratulations in advance. Thank you so much for coming on.
Thank you.
Thank you.
Thank you.
All right, everybody, well, don't go away, because after the break we have on Coach Chris Brown, and he'll be telling us how to maintain equality and diversity in the workplace. Alongside this, I'll be giving you my tips on how to get past cultural differences, and Dr. Rob Hicks will be answering your pressing medical questions, including this one. Is there a way to tighten up saggy elbows? Find out the answer to this after the break. Chrissy B, and my show is all about improving your mental health and being happy. Join me every Monday, Wednesday and Friday at 10 p.m. on my channel Sky 203. Visit chrissybshow.tv for more information and subscribe to our YouTube channel Chrissy B Show. You can also follow us on Twitter and Instagram at Chrissy B Show, and on our Facebook page, The Chrissy B Show. Welcome back to the Chrissy B Show, everyone. So we hope you've enjoyed today's programme so far, where we caught up with one of our past guests, Steed. We also spoke with Maggie Lennon about the amazing work she does with the Bridges programme, and she was joined by one of their success stories, Laeth Al-Sadi, who was a doctor from Iraq coming into the UK, but thanks to the programme is now becoming qualified in the NHS. Now, speaking of doctors, here is our very own resident Dr. Rob Hicks to answer some of your medical questions. And if you have a question for him, all you need to do is email us on doctor@chrissybshow.tv. Welcome to the show, Rob.
Hi, Chris. I'm enjoying the tea.
Good, me too. It just gets better every week, doesn't it?
It does.
Okay. Should we go straight to our first question, which was the one I mentioned before the break? And this person is asking, is there a way to tighten up saggy elbows? I'm a middle-aged woman and I don't like the way my body looks around my arms and elbows. What are my options in terms of surgery to clean up the saggy skin on my elbows? This is pretty important to me.
Okay, well, there are two approaches to this. The first thing is some exercises to do, where you would exercise, let's say, the triceps muscle, so that's the muscle back here. And by improving the tone of the muscles, you might actually find that there's less sagging. The sagging is unlikely to go away completely, but you might improve it, to a degree that you're more comfortable with your skin. The only other option really is surgery. So it would involve something called an arm lift, where a cut, an incision is made down the arm here, and then loose skin and loose tissue is removed, and then the cut is sewn back together again. Okay. And then, of course, you don't have the sagging, but you'd still need to keep the exercises going. to maintain any tone that you'd already achieved. So those are really the options.
What about scarring now that's left from the operation?
Well, nowadays, I mean, there would be a scar, but nowadays, I mean, with a cosmetic surgeon doing this sort of procedure, I mean, they're the best as far as scar is concerned. And you can always try. Some people use vitamin E, some people use aloe vera, all sorts of different treatments. But generally, you'll have a scar, but it's on the other side. It's on the underside, so you're kind of less likely to see it. Yeah.
Okay. All right, then next question. I'm a 17-year-old student with a history of insomnia. For the past couple of months, I've been waking up paralyzed and am only able to move after concentrating very hard on moving my fingers. It feels like I am dreaming. I am taking antidepressants. Are they causing this? Sounds quite worrying.
Well, it is. This is a frightening experience for anybody going through it. It's called sleep paralysis, and it's actually relatively common, particularly in teenagers and young people. What happens, as you're experiencing, is that you feel you're aware of what's going on, and that's what makes it so frightening. But you can't move and you can't speak. And this paralysis generally happens when somebody's waking up or when they're drifting off to sleep, and it lasts for seconds or maybe a couple of minutes. It's not harmful to you in any way, which is the reassuring thing, but of course, because you're aware of it, it's jolly well scary. Now, some of the likely causes are irregular sleeping habits, and if you're a student, then the odds are that that's possibly a problem. Sleeping on your back is another cause. It could be side effect of medication, and not getting enough sleep is another possible reason. So the first things to do is get a checkup with a doctor to make sure that nothing else is going on. And then what your doctor will recommend in the first instance is the sleep hygiene technique. So that's things like going off to sleep at the same time every night, waking at the same time every morning, making sure that your room and your bed is comfortable, quiet enough and dark enough for sleep. And in fact, we've got a doctor's orders video on sleep hygiene, so you may want to take a look at that from the website. It goes through all the different things that you can do to improve your sleep. And sometimes, interestingly enough, low doses of antidepressants are used to try and overcome this problem. So the other thing to do is look at the information leaflet that comes with the antidepressants you're taking to see whether it is a side effect, and then of course discuss it with your doctor. But be reassured that although this is a scary thing when it happens, be reassured that actually it's not going to harm you in any way. And sometimes once somebody knows that and appreciates that, the thing tends to sort of settle out and disappear.
Okay, lovely. Next question, Rob. What would cause skin discoloration on the stomach? I'm a male and I've had this spot growing on my stomach where the skin is a darker colour and sort of marbled looking. I'm not sure how to describe it exactly, but is this just a pigment issue or could it be something more serious like cancer?
Well, the simple answer to this is it would be really good to see this. Yeah. So I would say go along to your doctor, get them to examine you, because that's the best way of getting an accurate diagnosis. What's going through my mind is it could be some kind of infection, like a fungal infection. It could be a mole which is changing, and if you are seeing any changes, I think it's important to get this checked promptly. Or it may not be a mole; it may be something called a seborrheic wart or a similar kind of growth, which is not cancerous but can take on that sort of appearance. But my advice to you is go and get it checked with your doctor.
Definitely. Okay, next question. There is nothing wrong with my leg, but it still hurts. I had some tests done a while back, but my doctor found nothing. It is in the lower part of my leg. Could the pain all be in my head? That's a tricky one, isn't it?
Well, actually, the answer is yes. But really? What I would say is with a problem that's persisting, have it checked again in the first instance to make so that, because sometimes when we see our patients, what we get is a snapshot of what's going on, and a few weeks later other symptoms may have developed, things may have changed which help us make a diagnosis, even if before we thought there was nothing actually going on that was worrying. So get it checked again. To answer your question is yes, there could be absolutely nothing wrong with your leg, but you're feeling the pain in your leg. And I would say to you, this is not technically in the mind, but the pain is being driven from how you're feeling emotionally. So the pain you're feeling is real, but sometimes when we're under stress or we're worried about something and we're ignoring that, what the brain does is it says, right, I'm going to create a symptom in you that you are jolly well going to take note of.
Wow.
And it can be anywhere in the body at all. So pain will come from two places, either the part itself, in this case the leg, or from up here. And that could be what's going on. So if there's anything that's stressing you or worrying you, that's causing you anxiety, actually acknowledge it and address that worry, whatever it is, and then you will probably find that the leg pain will disappear.
That's so interesting.
It's fascinating.
Wow.
And I'm always cautious to say that to people, no, this is not actually in your mind, but the symptom is being driven by your mind and how you're feeling. So, for example, I mean, when I get stressed, one of the indicators for me is I get a tightening around my eyes.
Yeah.
And I've seen an ophthalmologist, an eye specialist, and I know there's nothing wrong with my eyes. And they said, this is because you're stressed.
Okay.
So, and some people will get heart palpitations, some will get butterflies in the stomach.
Yeah.
So it's actually a response to stress, but with this sort of thing, it's sometimes a person ignoring that, and so the mind is saying, look, you need to take note of how you're feeling. I'm going to bring your attention to it in a way where you'll sit up and take notice.
Wow, amazing. Wow. Okay, next question, Rob. Why is my hair getting so greasy? I'm nearly 29, female, never had any skin or hair problems before, but suddenly my hair has gotten so oily it looks horrible. What can I do about this? Is this a sign that there's something really wrong with me?
Okay, well, two people you could ask about this. One, of course, is your doctor. The other is your hairdresser, because I mean they're very, very good at identifying whether there might be a problem. Two things that spring to mind for me is, one, have you started hormone changes can cause this sort of problem. So have you changed in any way maybe the contraceptive pill that you're using, or have you started to use a hormonal form of contraception, so your body is getting extra hormones, and one of the side effects could be grease in the hair. The other thing could be quite simply that you've changed hair products, and actually that's what's causing the grease. One of the things that I understand from hairdressers is that sometimes you can make hair greasy because we all make something called sebum from glands in our skin to keep the skin moist. But if you're making this and you're combing it from the roots out along the hair, then that will make the hair feel greasy. So maybe you might want to try brushing less often. But I think one of the things to do is get it looked at in the first instance, your doctor, or indeed your hairstylist, whoever's quickest to see.
Okay, brilliant. Next question. At what age should men start shaving? I'm 16 and I don't have any facial hair at all, not even fuzz. Is this normal? All of my friends are shaving, so I feel like I'm not developing right.
Okay, this is a really good question. I'm very glad that he's asked this, because a lot of teenagers will hang in and they'll worry without asking the question. So the first thing to say to you is this could be perfectly normal. Yeah. When you go through puberty, there are different stages. So the first thing that generally happens is testicles get bigger for boys, and then you get a change in the penis size, and you get underarm hair, and you get your voice breaking. The other thing that happens as your testicles get bigger is that you also get some pubic hair as well. So those are the sort of things that happen initially. Then round about 4 years into puberty is when you develop facial hair and you can start shaving. So if you are going through all those stages, so you've already got enlarged testicles, you've got some pubic hair, maybe you've got some armpit hair, then it may be that you just haven't reached that stage when you're going to get facial hair. If you're not going through those other stages, I would ask your doctor to check you out. But one of the things to remember is each and every one of us go through puberty, but we go through it at different stages and different ages. So it's probably perfectly normal, but if you're concerned in any way that you're not going through all the stages at the right time, have a chat with your doctor.
Brilliant. Okay, and one last question for today, Rob. I've recently had a newborn baby and I'm worried she'll get sick because it's flu season. How can I make sure she doesn't get ill?
Well, in the UK, pregnant women are advised to have the flu jab. So I'm hoping that if our viewer is from the UK, that she would have had the flu jab. And there's two reasons for that. It's one, that it helps to protect not just her, but it passes on some protection to her baby as well. The other thing, of course, you can do is you can make sure that you're washing your hands regularly, certainly around in flu season, so that you're not then picking up the virus and transferring it to your baby. And try and keep your baby away from anybody who has the flu, but be reassured that you're certainly under the age of 6 months, it's not appropriate to have the flu vaccination, and your baby will have some protection. If your baby's over the age of 6 months and has a long-term condition, then they should have been offered a flu jab between the ages of 6 months and 2 years. So that's something to just think about. But generally speaking, your baby will have, under the age of 6 months, will have some protection from you anyway.
Brilliant. Rob, thank you so much. And
Pleasure.
we shall see you again next week for some more questions.
You will, but I'll drink my tea beforehand.
Carry on with your tea. Okay, thank you. Well, everyone, don't go away, because after the break, we'll be talking with careers expert coach Chris Brown on how to further diversity and equality in the workplace. And I'll be giving you my top tips on dealing with cultural differences in relationships. So stay tuned. Welcome back to the Chrissy B Show, everyone. So we hope today's programme has given you more of an insight into the great work being done in Scotland to aid refugees and immigrants to get into work in the UK. We've also had a catch up with our past guest, Georgia Steed, to see how she's been getting on following her last appearance on the show in February. We've also had on Ronald Delari Simpson to tell us what oils are great for your immune system. But now it's time to delve into the topic of jobs and careers with coach Chris Brown, who's here to tell us about how to further equality and diversity in the workplace. Welcome to the show, Chris.
Glad to be here, Chrissy.
Lovely to have you on.
Thank you, thank you.
So,
we
tell
are
us.
going to be talking about diversity, particularly, right? And when we talk about diversity, it's something that's much needed, right?
Yeah.
But I thought of another way of explaining this. Now, when we talk about diversity, let's look at it this way. Picture this. You've got two people going up a mountain, right? But they're on either side of the slope. So they're climbing up, but this person over here has one perspective of it, right?
Yeah.
This person over here has another perspective. If they talk to each other, they probably have different perspectives on it. They keep climbing up, they get to the top. When they're at the top, they join together and they look around and they see they have the same perspective on a wider view as well.
Okay.
Sometimes we got situations like that as well in the company. People have certain ways, certain habits, certain cultures, certain differences, might be, let's say, disabilities as well.
Yeah.
Right? But because you can't see it from that person's view, and that person has a narrow point of view, there's not much going on, right? That's unproductive for a company.
Okay.
So we're going to go through a few stages of this and see what would be. So
Okay,
let's think
let's
this.
have a look.
Okay, so we're talking here about a changing world. And when we're talking about a changing world, you've got to think about it. Things are moving faster than the speed of light, right? There's different laws, there's different ways about going about things. The world is bigger. We're talking about the internet worldwide.
Yeah.
And if you still think about what I said about going up a mountain, if you still got that view that was way back, you're going to be left out along the way. The
Yeah.
world is changing fast. We've got to open up a bit more, right? Diversity. All right, let's look at them. So we're talking about the pluses. The pluses of what are going to be the pros of diversity in a company. So when we talk about, one, we could talk about innovation, right? Innovation. Innovative people have different backgrounds, different outlooks, and
Yeah.
pool that together. When we're talking about pooling that together, we're talking about a talented pool of people. Imagine your company. And you've got all these talented pool of people from all different parts of the world, different skills as well. We're talking about skills that you can bring together and say, hey, this is my company. There are certain companies which we all know about right now. Obviously, I can't name them, but they're very big telecommunication companies. Get my tongue in right? And also, we're talking about companies that just say, look, this is who we are, and they stand united, even in their posters and everything. Now, I've seen a company, another one, which I will not name, where their advert does not show people of all different backgrounds, but they promote diversity. Now, if you're saying it, you've got to do it, right? Now, if it's your company, you've got to go back and think about it and look around you and say, does this really spell out what we're really doing in our company? Yeah? So let's move on to that. All right, so we went to pluses. Now we're talking about productivity. Going back to the same areas which I just mentioned about different backgrounds, you've got to think about it. You might have a certain way of doing something which is brilliant. I might come with another area, another spin on it, which will be brilliant as well. We work together, we're going to produce more, and we're going to produce more than what other companies are doing as well, because we've got a different spin there. So there's another plus as well, productivity. Productivity for your company. Think about it. Let's go. Right, now, I use this as an example. Now, we got here fairness. I always say the awareness of fairness, or the fairness of awareness, right? Whichever way you want to put it, right? I've copyrighted that, by the way, right? Okay, right, so think about this. I use this example many times in workshops, and I say this, look, you've got your team of people at work, and you say, I'm just going to treat you all to lunch. And we say, right, what we're going to do, we're going to go out, and you're all going to have fish and chips. Everybody's going to have fish and chips and a big steak on there as well, right? Mm-hmm. But you haven't taken time to think about each individual in your company, right? Some won't eat meat.
Yeah.
Some won't eat chips anyway, right? There's many other foods that we can actually eat and this, that, and the other, but you're thinking that you're being really nice and generous by doing this, but you haven't really thought about the individuals and their values, who they are, where they come from, what they've got to bring to it as well. So that's used in a very simple example, but this happens in other areas as well. Mm-hmm. Okay, moving on. Now, from fairness, right, we moved on, right, but there's something else I wanted to mention which I actually jotted down here. And for a company, you've got to really invest in training. You've got to update your staff all the time on diversity. Equality and diversity is one of the workshops that I actually run, but I really do mean this, because sometimes you're going to get somebody else who comes into your company and they've come with different points of views about this. They might be very rigid, they might be good at the job, but they might not be able to interact with others because of their narrow point of view. So you've got to put back in that training again and always renew it. Get somebody in, do training on equality, diversity. It will make a difference, it will shine in your company, and it will put you ahead of every other company who is not doing that right now. And to be honest, you've got no choice. Yeah, you've got no choice. If
you want to move on, right?
Yeah, we've got to move on. You know, we're in the, you know, like I said, we're moving as fast in the speed of light, and things are happening very fast. So diversity is what it's about.
Thank you, Chris.
It's a pleasure, Chrissy.
I will see you again very soon.
Right,
Thank you.
Thank you.
All right, everybody, so now it's time for my top tips on dealing with cultural differences in relationships. So let's get straight to my tips. So there are many different cultures getting together and intermarrying, and relationships come with their fair share of challenges anyway, and sometimes the cultural differences can add to quite a few problems. So here are a few tips to help you along the way. And for those of you that don't know, my husband is from Guyana. I was born in the UK, but my background is Greek Cypriot. My parents were born in Cyprus. So we did have a few issues, not really brought on by ourselves, but from outside influences, but I'll tell you about that as we go along. So the first tip is to be respectful of your differences. So don't just expect your partner to just adjust to your way of life or your way of doing things. So see it as though you are merging together rather than him or her just changing everything about themselves. There needs to be a balance, and there needs to be some understanding. So, you know, I think it's really unfair if, you know, you are getting together with someone from a completely different background and you just expect them to make all the sacrifices, for them to make all the changes, even to simple things like food. Maybe, you know, you're with someone and you just want them to only eat, you only want to go to restaurants that you like, or restaurants from your country, and that's really, really unfair. You're getting together with someone, so it's about, you know, the understanding one another. The second point is to learn about your partner's culture. So make an effort to actually get to know the culture, because the more you know and understand, the easier it will be to adjust. So make sure that you show an interest. It's a part of the person, and since you've decided to be with them, I think it's your duty to know as much as you can about them. And you can even learn their language so that you can actually communicate with the family. And I have a friend actually from South Africa, and she met someone from Portugal and they got married, and the family, his family wasn't very happy about the whole situation. You know, she was completely from a different country altogether. And they didn't really accept her into the family until she decided to actually learn Portuguese, and she actually speaks it fluently now. And when the husband's mum actually saw that she'd made an effort and she could communicate, that was it. They just welcomed her into the family. She's, you know, she's not treated any differently. Everyone loves her now. So it's just those small things that you can do sometimes. All right, I know learning a language might not be a small thing, but there could be other things that you could do that would actually make things easier with your partner, and with your partner's family as well. The next point is to consider social gatherings. So it can be really awkward at family gatherings if your partner doesn't understand what everyone is saying. So make sure you are actually sensitive to that, because there might be times when, if you, for example, just be aware. So if your partner's by themselves, just sitting there, everyone's speaking a different language, make the effort and be sensitive to the fact that probably they're feeling really awkward. So go over there, sit with your partner, translate if you need to. So otherwise they're not going to enjoy going to social gatherings. So just be mindful of that as well. The next point is to be prepared for sacrifices. Now, these sacrifices are very important. Now, in my personal case, I wanted to spare my husband from certain situations, especially when we went for a visit to Cyprus. Although most people were fine with us, and this was quite a number of years back, most people were fine, but we did get those really ignorant people that made certain comments or shouted things across the street to us. And even some family members didn't treat my husband very nicely. So because of that, even though my husband said, look, it doesn't matter, I don't really mind, but I felt bad for him. So there were certain things that I would actually avoid. So if I knew, for example, that he would be treated in a certain way, I would actually avoid going to those places with him, or at all, in fact. And those are the kind of sacrifices that I think you should make. So if you know that you'll go somewhere with your partner and they'll be treated badly, or people are going to make comments, why would you want to take them there? Why would you want to go there with them? It's not nice. It's putting them in an uncomfortable position. So I would rather, you know, not do that. So it's just about being mindful, and that there are certain sacrifices that you will need to make. And obviously the ultimate sacrifice, I would say, is if, you know, people don't agree with your relationship. Now, if people don't agree with a relationship, for example, because maybe your partner is abusive, they're treating you badly, that's one thing. Obviously, they have a right to think that way because they're concerned about you. But if they're not agreeing with your relationship because of the culture, because of a race issue, that's something completely different. And there are times you have to make a decision, like I did. I had to choose my husband over my father. And I didn't want to have to make that decision, but I did. And it was a sacrifice that I made. Okay, my father came round years later, you know, when so many things had happened already, like 15 years later he met my husband. But I was willing to make that sacrifice because I wanted to be with my husband, and I never regretted that at all. So, you know, be prepared for that. If you really want to be with someone and, you know, certain people around you don't accept it, then you have to make that decision. Do you want to be with your partner, you know, whatever happens, or are you just going to be influenced by everything around you? Well, I hope that's helped you guys out there. And if you have a story that you would like to share, don't forget that you can email us on info@chrissybshow.tv. You can also tweet us on @ChrissyBShow, or leave a message on our Facebook page, The Chrissy B Show. And if you'd like to know more about me and how I overcame depression and other mental health issues, you can visit my personal website, which is mylifeafterdepression.com. Until next time, bye-bye for now.